here, before we even do the suction, you want to hyper-oxygenate the person, all right? So if they're on the ventilator and you're going to be doing the suctioning, then you hit this button, and then what it does, it pumps in 100% oxygen, and you want to let them do that for like a minute or two. You hyperventilate them. If they're not on a ventilator and they're on supplemental oxygen, what you want to do is crank up the oxygen for about a minute or two before you do the suctioning, and then make sure you turn it back down when you start, after you do the suctioning. If they're not on oxygen or ventilator, then what you might want to do is have them actually hyperventilate. So in other words, they're blowing off a lot of CO2, and so they're going to be more on the oxygen side of this whole thing, which is great. That's what you want to do. So get a kit like this. You just pull this out of the closet, the area, and there's use a sterile bottle of saline. So what you want to do is you want to turn this on. Okay, so turn on the device before you get all sterile. Kind of makes sense, right? So turn this on first, and then you want to adjust this so that the needle goes up in the yellow zone between 80 and 100. Right, so that way you get decent suctioning. You can see the tube will start to suction right at the top, and then the stuff that you're going to be suctioning out of wherever it is going to go in the bottom of this. So there'll be continuous suctioning. Before you wash your hands, you might want to do two things actually. Just make sure the bottle is sterile. Okay, for one. Sometimes if it's open like this is, they'll write a date on there to see when it was open. Typically, it'll be within the last 24 hours. If it's longer than that, you might want to change out the bottle. So you just turn this out like this. You'll wash your hands. Right. So here's a typical case. And
so this is going to be your dirty hand. So
you open it up,
grab the tube,
and essentially you want it so that it's away from you. All right. So here's the situation. So you can see where you have the catheter, and then you have the gloves and the basin. The basin is really important. And again, you'd be doing the sterile technique type of thing, right? So you know how to remember how to put on the gloves.
Oh yeah.
No? So you're on the outside of the cuff. You put it on like this.
All right, just follow that.
So then you want to go underneath the other one, right? And I hope this one goes a little bit easier. And it does. All right, here is a little bit of a basin. So you just open it up. And with the basin, essentially what you're doing is you're taking this. Now, this hand is not sterile anymore, right? Because it's on the outside of the bottle. And that's fine. So we do this, pour a little in there. All right, this hand is not sterile, this one is. All right, so here is my catheter. I pull out my catheter. I can pull this out. And then what I'm going to do is, here's the sterile part, here's the unsterile part. I take the two, put them together. Now it's already suctioning, right? This little valve, there's my valve right there. So it's suctioning air, right? Now, air is coming in this way, but it's also coming in this way, right? If I do this, guess where the air is coming out, being suctioned from? Just here. So here, I'm taking the suction at the end. It's no longer coming from there alone. There it is. Okay. So here's my suctioning. So what I want to do is make sure that this is working. I get confirmation of this. I put it in the basin of saline, and I put my hand over it. I should hear. Right? That's kind of like what it sounds like, actually. So then, what you're going to do is you're going to be making sure that they're hyperventilating, or the oxygen, again, is at 100% before you do this. Tell them that it probably used to be in suction at this point. You're not the first one on the planet that's probably doing it to them. But you just want to let them know you're going to be doing suctioning and that this is what the procedure is going to be. So the procedure for us is we don't put our thumb on this yet. What we do is we kind of fish this around after we explain what we're going to be doing, and we go in there until we hear or feel a little resistance, right? Then what you're doing on a count of about 5, no more than 10, you put your thumb on there now, and then it's suctioning, and then what you want to do is kind of swirl, twist the tube as it comes out, right? And so there's a whole bunch of junk that's going to be in this tube. Go back over here. Right. Now the tube is somewhat clear. All that junk is up in here. No. And then we go back and again you're going to be tempted to put your thumb on there, Joan. Again, put it in there, a little twist, go in there until you feel a little resistance, or you can hear that there's kind of a cough from the person's side, they're telling you. So then, again, you put your thumb over it, twist the tube, and you almost count to 5, nice and slow as you're suctioning it out. Then as you get it out, bring it over, all that junk that's in the tube. You're going to be putting this in the basin again and then suctioning it out, clearing it. After a while, you should be able to auscultate again or listen to their breaths, make sure there's nothing that needs to be sucked out afterwards, okay?